Hello everyone, welcome to session 6 of Mayo Clinic Transform. I'm so excited to be here. There's a lot of innovation and collaboration here and I can't wait to see what's new in the healthcare industry. Mayo Clinic's always been a place with exceptional minds who come up with even more exceptional ideas. So, my name is Gigi Kreibich. I'm 23 years old. One time I went to a yoga class and I told the instructor I was 123. It was dark, she believed me, it was hilarious. I went to Stevens College in Columbia, Missouri, and I majored in biology and psychology. From there I went on and I was working at the University of Missouri's Cognitive Neuroscience Lab, where we did some autism research. And in 2017, I was diagnosed here at Mayo Clinic with a degenerative bone disease called hypophosphatasia. Hypophosphatasia is a metabolic bone disease, and it causes your body to not make enough working alkaline phosphatase. Alkaline phosphatase is the enzyme that hardens your bones. It's also known as basic phosphate, and it's genetic. It tends to cause lung issues, liver issues, kidney issues, and a lot of GI issues. It's fatal in 50% of infantile cases. It currently comes in 5 fabulous flavors. Perinatal, so that's when a baby hasn't been born yet. Infantile, and that's the most fatal form. It tends to have only a 50% survival rate. Juvenile hypophosphatasia, adult onset hypophosphatasia, and periodontal hypophosphatasia, which only affects your teeth, which are bones, which is kind of funny. So the biggest question I get asked when I tell people that I'm sick is they ask, how did you know? How did you figure out that there was a problem? And I always like to believe that it happened super fast, like woke up one morning, fell on the floor, was like, oh no, I'm dying. But in reality, it was a lot of really small issues that kind of compiled over time. I was very active in college. I was playing roller derby. I'm not sure if any of you have heard of that. It's like wrestling on quad roller skates. It's hilarious. Go see about. I was riding horses and I was doing a ton of extracurriculars. And around my sophomore year, it just kind of got slower and slower and slower, and I wasn't keeping up with any of my sports, and eventually I wasn't really keeping up with just walking around campus. And that's when I started looking for answers. Bless my parents' souls, they took me to probably every specialist in Minnesota trying to figure it out from the age of 12 on up. And it was very interesting because I had very abnormal presentations of this disease when it just didn't really match up with anything. So we would go to specialists and we would hear answers, a ton of different answers, everything from maybe it's adolescent anxiety things, maybe it's a woman's issue. And eventually, when I started going to Mayo, I was 14, we didn't really come up with any answers, we kind of got a handle on it. I went off to college, and then we started going back to Mayo to look for more answers. The interesting thing about it is that it took well over a year of diagnostics here at Mayo Clinic. And so I was bounced around from specialist to specialist to specialist, all of whom were giving me completely different answers. So we often think of health, we often forget that healthcare is a privileged tiered system. So what's crazy to me is even with my immense amount of medical privilege, the fact that I got to come here for diagnostics, it still wasn't enough. We had traced back blood work, which is normally where you start when you're looking at diagnostics. And we had blood work tracing all the way back to when I was 14 of almost no working alkaline phosphatase in my body. And almost every specialist we saw would cite it as it being a benign anomaly, probably of no clinical significance. After I had gone through about a year of rigorous testing and we still didn't have answers, I was so frustrated. I was ready to throw in the towel. I went and saw a geneticist who told me I was depressed, and then immediately went to my last appointment, which was endocrinology. And the endocrinologist took a grand total of 10 seconds looking at that blood work and said, oh my God, you have raging hypophosphatasia. And we were just flabbergasted by the fact that this had been missed so much. So it's very interesting to think about the fact that even across specialties, lack of awareness tends to really hurt patients in the diagnostic process. It hurts patients, it hurts their families, and it costs our health insurance and our general hospital system a ton of money. What doesn't make sense to me throughout all this is that research isn't accessible in regards to our healthcare and taking care of our loved ones. When you have a loved one who is sick for whatever reason, normally the first thing we say is, okay, we need to learn all about this. So your average Joe will go on the internet, get on Google Scholar and look for peer-reviewed articles. And great, you find like 10. You pop them open and there's so much science and so much medical jargon that you just have no idea what's going on. People often think that accessibility in the healthcare system is only about wheelchair push buttons and ramps, when in reality, it's making sure that our researchers have easy access to data and information so that they can be using their time to do their job and not spend all their time trying to get funding for their research. It's about making sure that that research, when you look at it, is readable by families and families of loved ones and the loved ones themselves. Because at the end of the day, no one cares about you more than you. No one's gonna need to advocate for you more than yourself. From there, we just kind of were flabbergasted by how hard the system was to navigate. And me, coming from a science and research background, I had a very difficult time, even though research is pretty much my whole life. So that brings us to, what do patients need in regards to the overall healthcare and the overall diagnostic process? And the answer to that tends to be they need resources. There is an organization called Soft Bones. It's the Hypophosphatasia Organization. It was founded in 2009 by a mother whose son was diagnosed, who was looking for resources and found absolutely nothing. There was absolutely nothing. She went, and the closest thing she could find was the Brittle Bones Organization for osteoporosis. And so she got in contact with them, learned about how they started, and from there started up the Soft Bones Organization. From the ground up, they now have a national research summit for practitioners. They have multiple patient meetings annually throughout different regions for patients and their families to go to and learn, get access to doctors and resources. They've also done a lot of fundraising and now have up to $50,000 of grant money that they grant in the spring of every year to progress hypophosphatasia research. So when you're looking back at that, the fact is that advocacy and awareness systems work. The problem with our healthcare system tends to be not that we don't have the resources, but that none of them are connected. We get lots of interdisciplinary issues that just simply aren't connected to each other enough to form a care plan. I was approached by an organization called Research to the People, previously known as SVAI, which stands for Silicon Valley Artificial Intelligence. And what they are doing right now is they're creating research networks for doctors, patients, researchers, all across the board. They are bridging the gap where people are falling through in the healthcare system. So they themselves aren't actually coding any sort of machine learning or artificial intelligence, but what they do is they get people who are doing the artificial intelligence, who are doing machine learning, who are interested in helping out with the diagnostic process and making sure that patients have access to all of the resources that are available to them. They're creating almost a social networking system for the healthcare system. And that's going to be so important going forward, because as we get better with science, as our medical technology increases, we're going to need to keep up with that and keep up with all the gaps that we're missing in regards to where human factors are failing the system. So, I sit here today and ask all of our healthcare practitioners around the room, what is missing in your patients' healthcare plans? What is missing amongst your data? What are things that you sit and look at and you say, I'm not really sure what this means, but I'm incredibly busy and don't really have time, so I'm gonna write it off as benign. This is where we need to start using our technological advantages to fix those gaps and make it easier for doctors. We need to make it easier for them to have those resources for patients and to have time to sit down and actually do their jobs when less time is spent simply trying to figure out who to contact to get those answers. I see healthcare as we're currently in this conundrum of we're trying to protect data in a time when cyberspace is fairly unstable in that we've got so much progress, but yet so many gaps in security. There's a lot of red tape up in regards to the healthcare system that are there for a very good reason. But at the same time, we need to figure out how to make data accessible for everyone so that instead of spending all of our time trying to figure out how to save money, how to use our resources better, we need to find a way to use what we have now to our advantage and focus on our patients, focus on our loved ones, focus on multidisciplinary care to make sure that people are getting what they need. And that's why I felt like it was really important to share my genetic data and share what I've been going through so far, because if I've spent my entire life doing research and I'm still facing all of these barriers in regards to figuring out what's going on in my life, I can't even imagine what it would be like for your average Joe who has a job completely unrelated to science. That means you have to wait and you have to make sure that you're kind of just waiting around for researchers to have an interest and then to find funding and then to say, oh, okay, I guess this is worth looking into. It's really, we're kind of at the mercy of our doctors and the fact that our doctors are human. They, at the end of the day, they're people with very, very educated opinions, very, very educated opinions. But those very, very educated opinions can sometimes be wrong and can sometimes be missing facts or gaps in that. And that's where our patients suffer, because if you don't have access to information, you have to take word for word what your doctor is saying, when in reality, it's impossible for a person to know absolutely everything about a field. An endocrinologist is going to have an overall specialty of what he's experienced with, but if they don't have a ton of experience, then unfortunately there's not a ton that they can do beside look at the research themselves and try to understand it. I was the first person here at Mayo Clinic to be diagnosed at Mayo Clinic with hypophosphatasia. They actually referred me to a specialist in St. Louis, and there's also a specialist of pediatric endocrinology at the University of Minnesota. The fact that we came here to Mayo Clinic in Rochester, one of the premier healthcare facilities in the world, and the endocrinologists aren't fully, they don't know completely what's going on with one disease, and I don't blame them. There's a ton of diseases out there and nobody can be an expert at everything. And that's where patient-led research is going to be so important, so that they're advocating for themselves and that they can educate their doctors and create an overall better healthcare system. Oftentimes, we tend to face a conundrum of the fact that our patients need care, but the healthcare system revolves around money, whether it's saving it, whether it's spending it, or whether it's trying to make it. So that means we need to find a solution that works for everyone, find one that's helping patients get better healthcare, finding one that's helping doctors save their time and energy, and helping insurance companies and hospitals so that they're saving money and they're not sending people all over the place when the answer is right in front of them. I encourage all of you to think deep down, because we all know that at some point in our lives, we are going to be sick, a loved one's going to be sick. So I encourage everyone to make sure you're doing your research and encouraging everyone else to do so as well. Share your story, share your information, share your data. and let's make healthcare easier for everyone. Thank you.
Thank you, Gigi.